everyone. For today's video, we're going to tackle about understanding coronavirus and how this virus can be transmitted and prevented, particularly at home and in school. So, coronavirus disease or COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spreads. Protect yourself and others from infection by staying at least 1 meter apart from others. Wearing a properly fitted mask and washing your hands or using an alcohol-based rub frequently. Get vaccinated when it's your turn and follow local guidance.
The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from the larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette, for example, by coughing into a flexed elbow and to stay home and self-isolate until you recover if you feel unwell. COVID-19 aerosol transmission. The virus can spread easily in poorly ventilated and/or crowded indoor settings where people tend to spend long periods of time. This is because aerosols remain suspended in the air or travel farther than 1 meter. COVID-19 spreads primarily from person to person. Droplets released when someone sick, sneezes, or coughs can land on the mouth or noses of people nearby. Close contact with someone sick, like hugging or shaking hands, reduce your risk of COVID-19 infection. 1. Clean your hands often. 2. Cough or sneeze in your bent elbow, not your hands. 3. Avoid touching your eyes, nose, and mouth. 4. Avoid close contact with someone who is sick. 5. Clean and disinfect frequently touched objects and surfaces.
Cover your cough and your sneeze. Cover your nose and mouth with a tissue when you cough or sneeze. Put your used tissues in the rubbish bin. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not your hands. Wash your hands well with soap and warm running water, or use hand sanitizer if you don't have soap and water. Dry your hands with a disposable paper towel or hand dryer. Prevent COVID-19 spread in your workplace. Wipe surfaces and objects with disinfectant regularly. Staff and visitors should have access to places where they can wash their hands with soap and water. Put sanitizing hand rub dispensers in prominent places and have them regularly filled. Cover face with the bend of elbow or tissue if they cough or sneeze. Keep surgical face masks and/or paper tissues available at your workplaces for those who develop a runny nose or cough at work, along with closed bins for hygienically disposing them. Consult national travel advice before going on business trips. Stay at home even more mild cough and low-grade fever, 37.3 degrees Celsius and above. COVID-19 spreads primarily from person to person. Close contact with someone sick, typically within 1 meter. Droplets released when someone with COVID-19 sneezes, coughs, speaks can land in the mouths or noses of people nearby.